And for obvious reasons. I mean, Roe pointed that out in the study. It's so hard to afford to live there. All the obstacles and challenges, the poor schools, the crime problems. My oldest daughter lives in San Francisco and getting married, and they're planning to move to the suburbs. So we'd like to see how we can make cities better places so people might actually stay if they want to stay. So this panel features PRI experts, and we're going to look at the nuts and bolts of ways to improve cities, improving healthcare, education, and controlling crime. So our first panelist literally needs no introduction at a PRI event. Sally Pipes is PRI's president, CEO, and Thomas W. Smith Fellow in Healthcare Policy. Prior to joining PRI in 1991, she was assistant director of the Fraser Institute in her native Canada. In January 2020, Encounter Books published her most recent book, False Premise, False Promise, The Disastrous Reality of Medicare for All, which reached #1 on Amazon.com's health law bestseller list. She's frequently called upon for media interviews, speeches, and debates, sharing her ideas for market-based reforms to provide better health care. And we sure know, as the state is trying to push single payer, that we certainly need Sally's efforts to push for market-based healthcare reform. She's published nearly 1,500 op-eds in 2022, and she writes regularly for a host of publications. Please welcome Sally Pipes.
Well, thank you, Steve, and it's a delight to be here to talk about my favorite topic, healthcare. I'm a one-trick pony. It's really all I can talk about is healthcare reform. And I don't know, maybe I'll go to my grave and have lost, but I'll go fighting till the end. So I'm here today to talk about a chapter that I have in a forthcoming Encounter book called The State of Black America. In looking at how do we improve the quality of life in our cities and build a vibrant middle class, it is necessary to look at the state of healthcare among the black population. The gap between blacks and Americans of other races on healthcare remains very, very wide, from access to insurance and prescription drugs to incidence of chronic disease and mortality rates. African Americans fare worse than any other races in the country. To progressives, this is proof of systemic racism, and it demonstrates that we need more government intervention in healthcare to equalize outcomes. But that will not solve Black Americans' healthcare problems. In fact, government programs deserve much of the blame for America's racial healthcare divide. It is important to trace how federal welfare programs have failed African Americans by saddling them with subpar coverage and penalizing them for trying to climb the economic ladder. I will conclude by offering some solutions, and I'm sure Steve will have some questions based on my talk, and so we can also embrace some of these issues about market-based reforms. The most striking racial disparity in American healthcare today is also one of the most basic. It's life expectancy. After all, what is the purpose of healthcare, of a healthcare system, but to keep people alive and thriving? That's why I'm still heading up PRI. The average life expectancy at birth for African Americans is 70.8 years, compared to 76.4 years for whites and 77.7 years for Hispanics. Black males have the second lowest life expectancy of any American subgroup, just 66.7 years. Things seem to be getting worse. White American life expectancy declined by 2.4 years between 2019 and 2021, some of that, of course, due to COVID, while Black American life expectancy declined by 4 years over the same period. Unintentional injuries, this is a new phrase, unintentional injuries, which includes, of course, drug overdoses, were responsible for 11.8% of that decline. Heart disease, liver disease, and stroke were collectively responsible for another 11.1%. Unintentional injuries were responsible for 22.7% of the decline in Black life expectancy. That's almost twice the share for white Americans. Suicide was responsible for 2.7% of the Black life expectancy decline. Deaths due to drug overdose have surged among Black Americans in recent years. According to data from the CDC, and I don't always like what the CDC has to say, published in July 2022, overdose death rates jumped 44% for Blacks in 2020 compared to 2019. The corresponding figure for white Americans was only 22%, or half. The longer-term gap in life expectancy is largely a function of chronic disease. 15% of Black Americans have diabetes, compared with only 10% of white Americans. African Americans aged 35 to 64 are 50% more likely to have high blood pressure than whites. And as a result, African Americans aged 18 to 49 are twice as likely to die from heart disease as whites are, while Black people are twice as likely to die of diabetes as white people. These higher rates of chronic disease can be explained in turn by overall population health. Nearly 20% of Black Americans report fair or poor health, compared with just 13% of white Americans who self-reported the same thing. 80% of African American women are overweight or obese, compared to 65% of white women. These disparities start at a young age. Nearly 13% of Black children have asthma. That's 13% have asthma, compared to just under 8% for white children. But not all of these disparities are the result of general health. Some are caused by disparities in care. A 2022 study found that Black leukemia patients aged 18 to 29 were more likely to die or not go into complete remission when compared with the white patients undergoing the same treatment. All told, African Americans have a higher rate of mortality for all types of cancer combined compared to all other racial and ethnic groups. A large portion of the healthcare discrepancies between Black and white Americans coincides with income differences. The African American poverty rate in 2019 was 18.8%. It was much higher than the national average of 10.5%. That year, household income for Hispanics and Blacks was $43,771 compared to $71,664 for non-Hispanic whites. Poor adults of all races are 5 times as likely to report that they are in fair or poor health compared to those whose incomes are at or above 400% of the federal poverty level, according to research from the Urban Institute. Poor Americans are at a much greater risk of chronic conditions, including heart disease, diabetes, obesity, disability, and mortality. But greater rates of poverty do not fully explain racial disparities. One 2017 study compared health outcomes among people with incomes above $175,000 per year and found that Black Americans still fared worse than their white counterparts. To really understand the issue, we must turn to social determinants of health. We were talking about that earlier. They cover everything from neighborhood condition and access to safe transportation to language and literacy skills and racial discrimination. In recent years, many people have zeroed in on just one of these social determinants, health, race, and racism, to explain the disparity, health outcomes between Black and white Americans. This argument's champions, as exemplified by an essay in Health Affairs in February 22, claim that laws and policies allocate resources in ways that disempower and devalue members of racial and ethnic minorities, resulting in inequitable access to high-quality care. Race is just one of the social determinants of health that negatively affect Black Americans. And social determinants are part of a broader tableau of factors that determine racial health outcomes. To improve African American health outcomes, we must first dispel the notion that racism alone is responsible for these disparities. Race is part of a broader determinant, socioeconomic status. As a review in the medical literature from 2007 put it, socioeconomic status is associated with more smoking, less physical activity, and poorer diets. Together, these behavioral choices increase a person's risk of chronic disease and obesity, which in turn results in lower life expectancy. Over 14% of African American adults smoke cigarettes, one of the highest rates of any group in the country. According to the CDC, Black Americans have the highest age-adjusted prevalence of obesity of any racial or ethnic group at all. Lifestyle factors like these can help explain why African Americans are up to 2 times more likely than other racial groups to contract most major chronic conditions. Breaking this cycle of poor lifestyle choices will largely depend upon and sometimes contribute to breaking a cycle of poverty. Breaking that cycle, in turn, will require freeing African Americans from the ineffective, outdated government programs that they largely rely upon for their health care. More than half of Medicaid's beneficiaries, and here in California it's called Medi-Cal, are racial and ethnic minorities, and they're subject to long waits, poor quality of care, devastating outcomes, endemic to any government-run program in healthcare. If we want to improve those health outcomes among Black Americans, we'll have to start here. Medicaid is proof positive that access to coverage does not necessarily translate into access to care. That's one of the big issues in Canada under the single-payer healthcare system. Madam Chief Justice Beverly McLaughlin said, access to a waiting list is not access to health care. By contrast, only 1 in 10 doctors is unwilling to take new patients on private insurance, only 1 in 10. Contrary to what progressives claim, the Affordable Care Act, or Obamacare, Medicaid expansion, which had Medicaid expansion as part of it, did not make things better. The Affordable Care Act boosted the number of people enrolled in Medicaid, but it did absolutely nothing to improve the quality of that coverage or to increase the supply of care available to its beneficiaries. In other words, Obamacare's Medicaid expansion funneled more people into long waiting lines, or what we call in Canada or England, queues. And more states are trying now to become covered under the Medicaid expansion under the ACA. And I'm hoping that states like North Carolina do not sign on to this, but it's a struggle educating people. Black Americans fall disproportionately into the welfare trap, which not only keeps them in subpar government-run health insurance program, but it also cuts them off from the myriad benefits of private insurance. One government program is serving Black Americans relatively well, and not coincidentally, it's privately administered. It's the Medicare Advantage program. About 13% of Medicare Advantage enrollees are Black today, according to a 2020 report from Milliman, a healthcare consultancy. By comparison, 9% of enrollees in traditional Medicare are Black. Nearly half of Black Medicare beneficiaries choose Advantage over traditional government-run Medicare. Compared to other government health programs, Medicare Advantage is cheaper, more comprehensive, and higher quality. Black Americans in particular are better served by Medicare Advantage than by traditional Medicare or Medicaid, as I just spoke about. The reason is simple. Private health insurance is better than public alternatives. Shifting the African American population out of government-run healthcare programs and into private insurance plans is another key step towards boosting their health outcomes. The shift must be done in 2 phases. First, we must break the misconception that welfare programs are what's best for Black Americans. That will require unfolding decades of progressive policy malfeasance. And second, we must enact market-oriented reforms across the healthcare sector to boost quality and cut costs across the board. Medicaid is just one part of a broader landscape of federal welfare programs that do more harm than good for Black Americans. Since the 1960s, progressive activists and Democratic politicians have taken it as a foregone conclusion that perpetually expanding federal welfare programs is the best way to help poor Americans and minorities, including African Americans. But over the years, the social safety net has entangled more people than it has saved. Broadly speaking, this is because welfare programs discourage people from working and improving their socioeconomic status. As renowned economist and my friend Thomas Sowell put it, the political left's welfare state makes poverty more comfortable while penalizing attempts to rise out of poverty. The Wall Street Journal's Jason Riley, who is Black himself and writes a lot on education and healthcare, he expanded upon Sowell's argument in his 2014 book, Please Stop Helping Us, How Liberals Make It Harder for Blacks to Succeed. Riley noted that between 1940 and 1960, well before any major civil rights or welfare programs took effect, the Black poverty rate fell from 87% down to 47%, gains attributable to African American migration to city centers and increased educational attainment. Yet between 1972 and 2011, the Black poverty rate stayed basically the same. And Thomas Sowell put a finer point on it. You cannot take any people of any color and exempt them from the requirements of civilization, including work, behavioral standards, personal responsibility, and all other basic things that the clever intelligentsia disdain, without ruinous consequences to them and to society at large. Unfortunately, healthcare is one policy area where, despite all the evidence to the contrary, progressives think the solution is to continually expand the size of government and the reach of government programs, ultimately pushing us in America, as Bernie Sanders wants, into Medicare for all. But the opposite is true. Market-based reforms can help African Americans secure better health care at a lower cost and ultimately realize much better health care outcomes. Lawmakers can do several things to boost access to affordable care. First and foremost, they can dismantle legal and regulatory barriers that limit the supply of medical care. Similarly, scope of practice laws restrict what types of services physicians' assistants and NPs, nurse practitioners, can provide without a doctor's supervision. Those rates have the effect of limiting the supply of care. Further, we do not have enough doctors to meet patient needs, especially in underserved communities. The United States, apparently, according to the American Association of Medical Colleges, will be short up to 124,000 physicians by 2034. Many docs are retiring early and going on to other things because of all the strain and stress put on by government programs. There are other things. We need to increase the supply of doctors, African American students, hoping that they can get better trained and they will serve in their own communities. So these are some of the things that we want to support, that we're trying to do, because Black doctors are also more likely than non-Black doctors to work in underserved communities which really need their help and conduct medical research into those topics that are pertinent to the health of the African American community. So those are some of the things that are very, very important. There's a lot of, I've written a lot on what the reform issues should be, and many of them are very relevant to the African American community. So I'll stop there and give Lance and Steve a chance to say their piece. So thank you.
Okay, thanks so much, Sally. Our next panelist is Lance Azumi, who is the senior editor of PRI's Center for Education. He's written and produced books, studies, and films on a wide variety of education topics. You mentioned education in Sacramento. Everyone knows Lance. From 2004 to 2015, he served as a member of the Board of Governors of the California Community Colleges System, which is the largest system of higher education in the nation. He also served 2 terms as president of the board. His recent books include The Homeschool Boom, Pandemic Policies and Possibilities, and Choosing Diversity, How Charter Schools Promote Diverse Learning Models and Meet the Diverse Learning Needs of Parents and Children. And his latest one, The Great Parent Revolt, is number 5 on the education policy charts at Amazon. So please welcome Lance Azu.
Thank you very much, Steve. I appreciate the generous introduction. Steve McShane, who was on the panel a little bit earlier, mentioned that he and I were on the California Post-Secondary Education Commission 25 years ago. And he said that, I had a lot of hair back then. Well, I would tell you, doing 30 years of education policy in California will do this to you. So, today at lunchtime today, we had a great speech by Keith Knopf. It was a terrific address. I was expecting a great speech, but he surpassed even my high expectations. It was a terrific speech. And for me, as an education person, one of the things that I really glommed onto in his speech was when he said, he talked about education. You don't actually hear a lot of business people talking about education. They'll talk about regulations and some of these other types of things. But Keith was able to connect the dots back to education, that so many of the problems businesses facing go back to the education system that we have here in California. He said that we are failing the next generation. He also said, we need people who can do stuff. Well, unfortunately, we're producing a lot of people who can't do stuff. What Keith was talking about was, something that we all are familiar with, even if we don't know the statistics. That California's education performance has been in the gutter for years and years and years. And so for decades, California has produced kids who are unprepared, not just for higher education. And I was president of the Board of Governors for the California Community College System, and we had massive amounts of kids coming in unprepared for college-level work, right? And what happens is then they're not going to graduate, even if they get into the system, right? You have a miserable degree attainment rate when you don't come in prepared. But what happens also after that, they're not prepared for workplace either. And so things were bad before the COVID pandemic. They are through the floor now. If you look at California pre-COVID, like for example on the National Assessment for Educational Progress with National Math Test, before the pandemic, in 2019, only 29% of 8th graders here in California were proficient in math. Now that's a miserable statistic, right? 29%. In 2022, after the pandemic, it's 23%. Less than 1 in 4 California's 8th graders was proficient in mathematics. And if you look, and we're talking all about urban areas today, if you look at our urban areas, it's even worse. So you take, for example, just south of all of us here, in Stockton. Just go down the 99 or the I-5 freeway, and you go to Stockton, and in 2019, you actually had 33% of the kids in Stockton who met or exceeded the state's math standards. That's not good. It's only 1/3, right? But then you look at 2022 after the pandemic, and the percentage of kids who meet or exceed that math standard, 15%. So that means that that initial 2019 statistic was cut in half, by more than half. And so you cannot sustain a state on 15% math proficiency. So the poor performance of California schools is causing what? If you were a consumer and, well, let's say you were taking Rayleigh's, right? and they weren't providing you with what you want, you would go to another store. Well, the same thing is happening in California. The system, the public school system, is not providing what parents want. So what are they doing? They're leaving. And if you look at California, for example, I'll take a story in the Los Angeles Times, of all places. They profiled an 8-year-old girl in Los Angeles who has dyslexia, but because of California's COVID policies during the pandemic, she was forced to be in front of a computer screen day after day after day through remote distance learning. She didn't get the type of instruction that she needed because of her dyslexia, and her mother said she would literally cry every day because of what she was going through. It was torture for that poor girl. And not surprisingly, what did the mother do? She took her kid out of the public schools in Los Angeles. And what that mom did in LA, she's not alone. You know, if you look at California, last year, the public school enrollment in California dropped by 250,000 students. There are now less than 6 million public school students in California, which is lower than it's ever been in 20 years. So what can be done? So, you know, Steve wanted us to be heavy on solutions, not just whine over statistics, right? Yeah, that's always your normal one. I hear that a lot at PRI. And so what are we going to do? Well, first of all, school choice in all its various forms, whether it's giving students greater access to charter schools or to private schools, offers great academic advantages. I was talking before I came up here to Cullen Coates over there, who was telling me about his grandson who had a complete change in his outlook on education because he went from a regular public school where bad things were happening to a terrific charter school called John Adams Academy, which I actually profile in my book, Choosing Diversity, which Steve mentioned, and it's totally turned his life around. So that type of thing that goes on in that one school with that one student is what it can be accomplished if we had greater school choice for everybody. All right? If you look at studies, let's say, of school choice writ large, like the University of Arkansas did a huge comprehensive study of school choice. And what did they find? They found that, for example, when you use vouchers to access private schools, that the students made huge gains in math and reading. Similarly, historically, California students who went to charter schools do incredibly better than students who attend the regular public schools. And this is especially true if they are in urban areas like Los Angeles and Oakland. So, but I think it's important for all of us here today, because we've heard talk about blight and rundown cities and all of those sorts of things, that when we improve education, it's not just improving test scores. If you actually give people school choice, you have a huge panoply of benefits accrue to cities, in addition to the children in them. And so you look at a study, like, for example, by the University of Texas at San Antonio, that looked at a voucher system that was implemented in Edgeware, which is right outside of Dallas. And it's a historic city, but it was in huge decline. But the city implemented this voucher program, and what did it do? Well, first of all, not surprisingly, it turned around the education performance of the kids. So you had huge increases in graduation rates, exemplary and recognized schools, and faster growth in test scores. Okay, great. But what about the other things that we're talking about here today? So what they found was that the community effects are the most noteworthy outcome of the voucher program. And so according to the study's findings, the voucher program had significant positive impacts on single and multi-family housing numbers and market value and commercial development. So prior to the voucher program, the city had experienced years of declining property values. But over the 10-year span of the voucher program, the total value of the property on the tax rolls within the boundaries of the Edgeware Independent School District actually rose by 86%. Because people were being drawn back to Edgewood due to the voucher program, government school leaders who had predicted that this was going to result in a massive loss in revenues for the district were proved wrong. Indeed, the voucher program, which caused a $6,500 rise in the value of the average school district single-family home, that netted the district an extra $11 million in additional property tax revenues. And so the district's total revenues per pupil rose 70% during that 10-year term of the voucher program. So clearly the study said that you had documented increases in property value, business formation, and that all meant that the families were moving back to Edgewood, I should say. And that's why it's so important for California. I mean, we heard before from other speakers how we've had declines. I think Rowena was mentioning Wayne Weingarten's studies where you had this exodus of people from our cities, and Los Angeles, San Diego, San Jose, San Francisco. If the parents in these California cities had a school choice tool like the Edgewood voucher to ensure better education options for their children, the impact could help reverse these population trends. Remember that the University of Texas study concluded that the community effects are the most noteworthy results of the Edgewood voucher program. According to the study, a large segment of the population wants private school choice, even within severe limits of like a current menu of school choices, badly enough to quickly relocate. So further, the study said that increased business activity then follows, so that a locality or state interested in stimulating economic development while also kicking the school system, public and private components combined, forward, need to look no further than a universal voucher program that offers a voucher amount large enough to cover the cost of tuition at private schools, while also avoiding price controls by allowing parents to add on to whatever the voucher amount is. So it's important for Californians here, and I'll stop because I want to give Steve a chance to talk. In California, we should look to Arizona, which has a universal education savings account program that was enacted last year and is the most comprehensive of any state in the country. And I think that if we want to improve our state and improve our cities, we need to look at school choice first and foremost. Thank you.
Yeah, I think that hit the gloomy but hopeful. So anyway, thanks, Lance. Our next panelist is Steve Smith, who's a PRI Senior Fellow in Urban Studies. Steve has had a third-year career in the criminal justice system in a variety of assignments that began in 1988. He's been a municipal police officer, sheriff's deputy, and district attorney's investigator in California. He's also been an international police officer for the United Nations and the Organization for Security and Cooperation in Europe, working primarily in the Balkans. For 14 years, he served as lead instructor in the Administration of Justice program at Gavilan College in Gilroy, instructing students for future criminal justice employment. He will share with us the findings of his new PRI study, Paradise Lost, Crime in the Golden State, 2011 to 2021. Please welcome Steve Smith.
So when you have a failing healthcare system and you have a failing educational system, you get me. It should be no surprise that crime in California is rising. It was rising before COVID, and it continues to rise after COVID. I don't say this with any relish or pleasure. In fact, when I began this study, I was unaware. I had retired from law enforcement and teaching in 2018 and had kind of put it out of my mind like a lot of ex-cops do, right? Time to find other hobbies, stop looking at all the ghosts that haunt you as you drive through the town where you saw crime scenes happen, right? So what my research assistant and I found was disturbing. And that increase in crime began in 2011 with the passage of AB 109. AB 109 was designed to reduce the prison population and help close the budget gap that had occurred because of the 2008 to 2012 financial crisis in California and in the United States, right? It was passed by Governor Brown and the legislature. What's ironic is just a few years before that, Governor Brown testified across the street before the Little Hoover Commission and advocated for keeping people in prison longer because they weren't rehabilitating. When he was governor the first time around, he instituted a program known as determinate sentencing. That meant that anybody convicted of a crime in California either got the mitigated sentence, the midterm, or the aggravated sentence. Absent any factors in mitigation or factors in aggravation, everyone would get the midterm. Why did we do that? Because he wanted to correct racial inequities in the justice system. He retired for a while and then became mayor of Oakland, if you recall. And Oakland has some criminal justice problems, right? What he found was inmates being released from prison and returning to the streets of Oakland, and I'm going to quote him here because I was at that hearing, were raping and pillaging his city. He was florid, like he could be, right? Testifying with his arms waving that we needed to return to a system of indeterminate sentencing in California, that we needed to keep dangerous offenders in prison until they rehabilitated, not release them automatically. And we need to establish clear benchmarks for performance while they were inside the institution, and we needed to fund the education and rehabilitative programs in order to help them achieve that. And I'm a conservative and a libertarian, but I agreed, right? There's no point in having a prison system unless it, A, deters people from going into it, B, rehabilitates them, or C, incapacitates them, meaning while they're in the institution, they at least are not hurting innocent people, right? And then the budget crisis hit, and none of it happened. Since 2011, the crime rate in California has increased in every violent crime category, and in the areas where it has decreased, it has only decreased because we have redefined crime, as Keith Knopf pointed out to you. The number of commercial burglaries did go down in California. That's because commercial burglaries became misdemeanors, where in the past they used to be felonies. That's went down because we no longer prosecute thefts under $950 in value as felonies. And even when we were doing it, we didn't prosecute everybody. In the criminal justice system, and you heard that I was a municipal cop, I was a deputy sheriff, I was a DA's investigator, I saw the scope, right? The system isn't run by inhuman robots. We know the difference between somebody who's stealing for profit and somebody who's stealing to feed their family. And we handled those cases appropriately. We already had diversion programs for low-level thieves, right? And we had jail for the sophisticated ones, the ones that were using it to line their pockets or finance drug habits, right? The cost of incarceration, right? So we passed AB 109 in order to reduce the cost of the prison system, which is substantial. Running a prison system costs a lot of money. Inmates are expensive, and as they age, they get sick, and their healthcare costs go up, right? So parallel to all of this, the state was fighting a battle with the federal government over how crowded our system was and the lack of quality healthcare that existed in it. So we addressed the crowding issue by passing Prop 57 and Prop 47, right? We'll just kind of stop it at the gate, and we'll release all the ones that we don't think are dangerous, right? Concurrent with that, we improved healthcare. To the point, believe it or not, and this blew me away, the death rate, if you will, or the mortality rate, to give it a more medical term, is half in the prison system as it is outside. I mean, I think we fixed the prison healthcare issue. Right? It's actually better than half. Right? We've done that at great expense, and we haven't saved any money. Right? What we have done is released tens of thousands of inmates, as Governor Brown correctly predicted, would return to the civilian population to rape and pillage. Rapes are up 81% since 2011. And they're aided because we have decriminalized, in effect, the use of date rape drugs, or the possession of date rape drugs. GHB, Rohypnol, and all the drugs that fit in that stupefying category of drugs are being used to incapacitate victims, affect their short-term memory, right, and commit crimes of sexual assault, right? So it's a double attack on sexual assault victims, right? They have no memory of it. We can't prosecute them. It's a felony if you use the drug, you know, in the furtherance of a rape. But how do you catch them for that? Because the primary witness has been administered a stupefying drug and has no memory. It's impossible, right? I'm going to give you a laundry list of legislation, and just keep that in mind, and please read the report. But so 2011, right, we had AB 109. In 2014, we passed Prop 47, and you already know what that did. $60 million a year to Raley's alone in theft. Now multiply that over all the retail businesses in California, right? We're talking hundreds of millions, if not billions. In fact, we're talking billions of dollars. And who pays for that? Raley's doesn't eat it, right? They pass that cost on to the consumer. They have to, right? And so does every other business, right? And who does that affect the most? That increased food costs? The poor. Most of us in this room can probably pay $5 for a dozen eggs, right? But how about the working poor? In 2016, we passed Prop 57 and began the process of releasing even more prisoners from prison, right? By the way, when you voted for it, and I did too, because I believed that releasing nonviolent prisoners, right, and then using the salary savings to fund our schools would be a great idea, but it didn't happen. All categories of prisoners inside the prison system qualify for Prop 57 early release. Even sex offenders, even murderers, as long as they don't have life without parole or a death sentence hanging over them. And then on top of that, we accelerated the release because of COVID. Even though prison inmates are a protected population and it actually suffered far fewer fatalities per capita due to COVID than the rest of us. As long as you didn't transfer the prisoners between institutions, it didn't spread, right? It's simple. So did you get that right? All categories of prisoners are now eligible for release under Prop 57, with the exception of people serving life without parole or sentence of death, right? Prop 57 means that if you committed 6 rapes, the Board of Prison Terms only evaluates you if you committed 1. If you're a member of a gang or used firearms in the furtherance of your crime, those factors are not considered in the valuation for parole. We went even further. In 2018, we passed SB 1391. That essentially prevents charging juveniles as adults, right? Now, the idea of charging juveniles adults sounds draconian, and if you follow what I write in my blogs on the PRI website, you'll know that I've said that before. It is draconian, right? The funny thing is, we almost never did it, right? When AB 1391 was passed, I believe we charged less than 200 people in California as adults. right? In a state of almost 40 million people with 58 counties, 200. It doesn't seem like a lot to me. Here's what charging juveniles as adults enables law enforcement to do. It enables law enforcement to prevent adult offenders from exploiting juveniles because they have a free pass in the criminal justice system. If you're a cop on the street and you stop a carload of gangsters and there's guns and weapons in the car, guess in whose possession the guns and weapons are going to be? They're going to be in the possession of the juvenile, because the juvenile has an advanced form of legal immunity. It's like Dickens has gone crazy in California. Fagin, you remember the character from Oliver Twist? You got to pick a pocket or two. Well, they're not picking pockets. They're shooting and killing people in Santa Cruz County just since SB 1391 was passed in 2018. There have been 4 juvenile homicides. One of them involved the rape and execution of a 9-year-old girl. And that young man will be out of prison by his 25th birthday. Folks, that's insane. That's not just, and that does not protect juveniles. It makes them open to exploitation. And frankly, it teaches immature minds that they can commit crimes without consequence. And every parent in this room knows you don't do that. In 2021, we passed AB 3234. Elderly parole. Sounds reasonable. Before the passage of the bill, you had to be 60 and have served 30 years consecutively before you were eligible. Now, it's only 50, and you only have to have served 20 years. I'm 59 years old. Cops now have to work till they're 55 before they're eligible for retirement. So you're telling me a cop can work till he's 55, but a prison inmate can get paroled at 50 because he's elderly? Come on. In 2022, we passed SB 73, one of the most insidious laws this state has ever passed. You're going to read in the report that in 2021, nearly 10,000 people died of overdoses in California. That's on top of the increasing number of doses that have been going on for 20 years in California. Okay? Most of those people who died of fatal overdoses died of an opiate overdose, and most of those opiate overdoses were fentanyl. SB 73, which passed last year and became effective January 1st this year, allows opiate dealers who sell fentanyl to get diversion. So we has essentially allowed the flow of fentanyl into the community by dealers who face nothing more than a ticket and an order that they go to class. What's the tipping point going to be? In 1994, the tipping point was the murder of Polly Klaas. And I think we're all old enough to have remembered what that was like, right? What's it going to be in 2023? Or does it even exist anymore? Or have we reached an acceptable level of death? Because it feels like that now. I intentionally do not use per capita numbers in this report because I think they're misleading. Telling somebody that 6.1 people per 100,000 people are murdered in California every year doesn't mean anything, does it? You have to do some math. Okay, well, there's about 38 million people in California, and divide that by 100,000, and then divide that by 6.1, and that tells me how many people were killed. That's absurd. We're not talking about almond production or how many grapes we grow. We're talking about human lives. So what you see are the numbers in there, the actual number of people who are dying or are the victims of crime. I want to leave you with one thing. A lot of homicides are hiding inside the aggravated assault statistics. Okay? 18% of people who are the victim of aggravated assault were a victim of a firearms crime. It means they were shot. Okay? The fact that they didn't die means they get lumped into aggravated assaults instead of homicides, regardless of the intent of the shooter. You get what I mean when I say that? Murderous intent is running far above the number of murders in California. And the only thing preventing that from being even worse is the amazing work that our healthcare system does to save their lives. In the trauma centers and the expensive helicopters we've got buzzing all around this state. Some of you are from Los Angeles, you see those things flying around all the time. Right? That's what's preventing a far more serious death toll than what we have right now. And even in the areas where we're seeing homicides reduce, right, the aggravated assault statistics are going up. Yet these guys are going to go to prison for assault with a deadly weapon or even attempted murder, and they're going to be Prop 57 eligible. Oh, because they only have to serve 50% of their sentence now. It's bad news. The good news is we can reverse all that. Get better health care, get better education, hold offenders accountable, spend the money on rehabilitation and treatment, right? And we can turn this ship around. Thank you very much.